Welcome to the City Club of Portland, Oregon's premier citizens forum. We're delighted you're with us today. I'm Don Williams, president of City Club. Our program today is a debate on Oregon Ballot Measure 50. State Representative Sara Gelser will represent the proponents, and J.L. Wilson, spokesperson for Oregonians Against the Blank Check, will represent the opponents. Our debate will be moderated by Steve Cantor, professor of law at Lewis and Clark Law School. For the benefit of our radio and television audiences, please turn off your cell phones and other electronic devices. First, a few announcements. Join us next Friday for our address by Bill Wyatt, Executive Director of the Port of Portland. Bill's address will be entitled Portland's Gateway to the World, and he will discuss both sustaining and expanding Portland's status within the international trade arena. The Coalition for a Livable Future has published a regional equity atlas. It's a collection of maps, data, and intelligence on the concept of equity planning within the Portland and Vancouver metropolitan region. Join City Club for a workshop which will be facilitated by the co-director of the coalition. And this workshop will give a brief overview of the atlas and feature an exercise to help participants think about how they can support healthy and sustainable communities. The event will be on Thursday, October 25th at the City Club Commons. It'll be from 5 to 7 p.m. And if you would like to attend, please RSVP with Kim Adams-McCool at the City Club office. We'd also like you to mark your calendars for next Friday between 4:30 and 6, when City Club members and their guests are invited to drop by for a special Friday Forum open house. And this gathering will give you an opportunity to learn more about the November ballot measures that City Club has researched, both ballot measures 49 and 50. And members of the research committees that wrote those City Club reports will be present to answer your questions. This event is free, open to the public, and no reservations are required. We have a number of new members today, and I'd like you to help me welcome them. Please hold your applause. They'll stand and hold your applause until all are introduced. First, Jim Blackwood, who's in the back of the room, who's a graduate student. Steve Clem, who's a manager at Skanska. John Helmer from John Helmer Haberdashery, and Isaac Flum, who's with Northwest Mutual Life. Welcome to City Club. We're also very fortunate to have terrific corporate sponsors, and the sponsors for this quarter are the law firm of Barron Liebman, LLP, and Girding Edlin Development. We thank them for their support. The value of the City Club is reinforced during election season. Last Friday, we just had an excellent debate on ballot measure 49, and prior to the debate, City Club members voted upon the adoption of this research report on the subject of today's debate, Measure 50. Healthcare, and more specifically, coverage for children, is the topic of both national and statewide discussion. President Bush created controversy by his veto of the Children's Health Insurance Program. The proposed funding of the Oregon Healthy Kids Plan by a tobacco tax has also garnered national attention. Funding health insurance for children is consistent with a 2006 City Club research recommendation. However, embedding a tax in the Oregon Constitution is also contrary to a previously adopted City Club position. This topic also relates to other City Club programs and research on campaign financing. Now, Oregonians know the importance of their state constitution. However, should voters be skeptical of the approximately $10 million that Philip Morris and J.R. Reynolds have purportedly spent to preserve the sanctity of the Oregon Constitution? Well, we're fortunate today to have Professor Steve Cantor as our moderator. He has appeared as a City Club speaker and moderator on numerous occasions. He was Dean of Northwestern School of Law at Lewis and Clark College for 9 years. Earlier in his career, he was Assistant Director and Chief Attorney for the Metropolitan Public Defender in Portland. Professor Cantor has taught law as a Fulbright professor in both Greece and China, and he also served on a 3-member international panel that assisted Kazakhstan in writing a new constitution. Not only does he have academic credentials, but he's also interested in athletics. He's the president of the Portland Baseball Group, and many of you know that this group continues to lead the statewide effort to bring Major League Baseball to Portland. Many lawyers are tough negotiators. Steve is affirming that image because he recently took up adult hardball, and this sport is a great blend of both his legal and athletic skills. And of course, I'd be remiss if I didn't tell you about his authorship of a children's book, The Bear and the Blackberry. Steve will sign either your baseball glove or a copy of his book after the program. Please welcome Steve Cantor.
Thank you, Don. It's a pleasure to be back at City Club. That sounded pretty impressive. In full disclosure, I should probably say the Kazakhstan Constitution lasted about 18 months. They're on version number 3 at the current time. But I very much appreciate it and appreciate all the good staff work as usual. One of the things I love about these City Club debates is at the end of the day, unlike a prize fight, the result is not determined by 3 judges who may or may not be impartial, but it's really determined by City Club members, by the listening audience. These programs go out all over the state, and most importantly, by the voters on November 6th when they're going to decide the fate of this measure. And that's what this is all about, to try and inform as much as we can in a short period of time the electorate that will make this decision. We have 2 important ballot measures on the ballot, and all of us should do what we can to get the word out. I'm the moderator, which means I'm largely going to try and disappear quickly and let the 2 speakers, proponent and opponent, have most of the floor. I will, however, ask the first series of questions for about 20 minutes or so, and I will try to be not just a moderator, but an instigator and a bit of a provocateur, although a fair one, I hope, so that we can get as much information and sharpen the questions as much as possible. And then, of course, you'll have a time for your own questions. You know, it is almost inevitable, just to comment on the power of City Club. Here you have this debate today. What does the Oregonian do above the fold in today's paper? States get hooked on tobacco taxes. It's inevitable. Whenever you're talking about a topic, there's always something in the media relevant to it. But I suspect the City Club having this event today may have provoked the media even more than it might otherwise to get on this topic, which is good. Don has already given, I think, enough of a sense of what the measure is. This is ballot measure 50. It is a constitutional amendment referred by the legislature. It would increase, if passed, the cigarette tax in Oregon by 84.5 cents a pack to, I believe, $2.03 total state tax, putting us about on a par with Washington, but above California or Idaho's current tax. As most of you know, on the constitutional issue, currently in our Constitution, for the legislature to adopt or increase a tax requires a 60% vote of both houses. Ironically, in Oregon, to amend our Constitution, it takes 50% plus 1 of our voting public, not a supermajority, but that's where we are, and I'm sure those issues will come up. Our format is very simple. Each party will have 3 minutes for an opening statement. Then we will have questions from me with a little brief time for rebuttal for each of them, then questions from the floor, and finally a 2-minute closing from each party. Hopefully that will allow a lot out. Just before I introduce folks, I do want to introduce the 3rd most important person here. Our 2 debaters are the 2 most important, but the 3rd is Chris Smith, who's our timekeeper. And I've been on the other side of this when I was in a debate and I was rolling, and I got a little note from the moderator that said, "Steve, you're out of time, conclude." And I politely sat down after concluding. So I hope our speakers will both adhere to the time so that we can get lots of questions and so on. And Chris is a tough customer. Now, I will say that I always wished when I got that note that I had the presence of mind to say, I see by this note that my opponent has graciously conceded the remaining points so I don't have to make them. But to make sure that neither of our speakers do that today, I brought from my time in China a little cigarette lighter that I thought appropriate. And if anybody goes over time, we'll open it up. Plays the Chinese national anthem, that'll get you going, and if not, it's very hot, so, make sure you stick to the time. It is a great pleasure to introduce our two speakers. First, Representative Sara Gelser. Sara represents the Corvallis-Philomath area. She lives in Corvallis with her husband and 4 children. She is clearly a rising star in the legislature and in the Democratic Party. Appointed first to the legislature, she was elected in 2006. And by this session, she was already Assistant Majority Leader for Policy. Pretty rapid rise, and I'm sure there are further great things ahead. She's been dedicated for a long part of her life to children's issues, issues relating to the developmentally disabled, and to prove in typical Oregon fashion that our two speakers have a common interest, she was instrumental in getting through the legislature a streamlining provision for electronic permitting for contractors. And our opponent speaker, as I'll say in a moment, spent a good chunk of his career representing small businesses. So I suspect there's some commonality, at least on that issue. I did ask each of them sort of a trick question going in. Sarah's favorite football team is OSU. She's from Corvallis, what can you say? Now, that shows we're going to get a hard-hitting, honest debate, because I thought she might waffle. She has a slight connection to Lexington, Kentucky, and I thought she might avoid the OSU-Oregon debate by saying the University of Kentucky with Rich Brooks, but she hasn't actually lived there. She's just involved with an organization there. She's educated at Earlham and at Oregon State, and her favorite movie is When Harry Met Sally, for what that's worth. Mr. J.L. Wilson is here representing the opposing point of view, opposing ballot measure 50. He is with Galt Public Affairs, a pro-business lobby firm primarily, and they represent a number of large clients. As you can imagine, some of the biggest contributors to this particular campaign against Measure 50 are big tobacco companies. J.L. Wilson represents a number of big companies. He's also, as I said, for a long time worked with small business, representing 12,000, I think, small business entities in our state, and been very active in the legislature, serving 2 speakers of our House, and now working from the lobby and public relations and communication side of things. He grew up in Grants Pass, Southern Oregon, a Willamette graduate, was a member of Kaiser City Council. I switched questions on him just a little bit. His favorite baseball team is the Red Sox. I think the right answer to that one actually was the Oregon State Beavers for winning the College World Series, but the Red Sox are more current. And his favorite book, Atlas Shrugged. Without further ado, it's my delightful pleasure to introduce our 2 speakers. By a prearrangement, the opening statement first will be given by Representative Gelser in favor of ballot measure 50.
Thank you. Ballot measure 50 gives voters the opportunity to expand health coverage to over 100,000 Oregon kids who need it now. Because the Healthy Kids Plan is paid for with a tobacco tax, it will also improve health by reducing smoking statewide. The tobacco industry has spent over $10 million to confuse and mislead voters about Measure 50. The tobacco industry didn't hesitate to lie to Congress while under oath, so it should be no surprise to us that R.J. Reynolds, Philip Morris, and their spokespeople will stop at nothing to protect industry profits. These are the real facts about Measure 50. Right now, over 100,000 Oregon kids don't have health coverage. These kids are 10 times more likely than kids who do have health insurance to go without needed medical care. And kids who don't receive early and preventive medical care are more likely to end up in emergency rooms and require expensive treatments, the cost of which are passed on to the insured through higher insurance premiums. Measure 50 will provide health care to over 100,000 Oregon kids. The independent, nonpartisan legislative, fiscal, and revenue offices have both demonstrated that this is an accountable and sustainable program and that the funds raised by Measure 50 will go to health care. The new funds are locked in the Constitution so that neither politicians or lobbyists can divert these funds for other purposes. The Healthy Kids program even sets aside revenue to protect against any unforeseen revenue shortfalls in the future. This ensures that taxpayers aren't stuck with a bill they don't expect. And finally, audits of the Healthy Kids program are required to be conducted and made public every 2 years. Raising the tobacco tax is the best way to reduce smoking in adults and to prevent children from ever starting to smoke. When passed, Measure 50 will keep 30,000 children alive today from ever becoming smokers. And Measure 50 will double our tobacco prevention and cessation programs, which means better health for all Oregonians. And this is the real reason why we're hearing so much from Big Tobacco. They're spending millions of dollars here, not because they care about Oregon, but because they don't want anything to get in the way of a steady supply of what their industry terms replacement smokers. In other words, our kids. Measure 50 is what's finally needed to provide our kids with the health coverage they need today. That's why supporters of Measure 50 are the organizations and people you trust, Oregon's doctors, nurses, faith leaders, and business leaders, and dozens of proven advocates for public health and family policy. It comes down to this. Over 100,000 Oregon kids need our help today. They need us to stand up to Big Tobacco and put their needs first. Measure 50 provides these kids what they need today, desperately needed health care. Please vote yes on Measure 50. Our kids can't wait.
Mr. Wilson?
Thank you. My name is J.L. Wilson, representing the No campaign. And at the outset, I'll give you 4 reasons that we oppose ballot Measure 50. First of all, according to the latest numbers from the Legislative Fiscal Office at the outset, this tax, most of which does not go to the Healthy Kids program. In fact, only 25% of the revenue is dedicated to the Healthy Kids program. What we see with the $147 million that's raised, over half of that, $75 million, is completely unallocated and completely unexpended. There is no constitutional protection for this money. It is not directed to be at the Healthy Kids program. It is there for the legislature to spend. Granted, it has to be spent on a DHS program, but there's only one word for a $75 million pot of money left lying around in the legislature, and that word is spent, and it won't be on the Healthy Kids program. The second point is that you cannot possibly sustain a program with a growing appetite for money with a revenue source that you expect and even want to decrease. With this program, the cost will increase 2 to 3 times in the next couple of years, and yet tobacco revenues decline at a 2.2% clip every year. This is the illogic of using a cigarette tax to fund a growing health care program. One featured economist in the state even mentioned that the inclusion of kids who are currently insured through employer health plans and whose parents are actually writing checks, whose parents are 200% of the federal poverty level, even if a fraction of these kids transfer over onto this program, we'll see deficits starting in the next biennium. This would in fact be the first product tax in the Oregon Constitution. We've never before contemplated taxing our citizens and doing that through the Oregon Constitution. In fact, the Democrats in the legislature agree with me. You'll be voting on an issue next year that removes the double majority provision from the state constitution. And you know what? I agree with them, because you can lock yourself into the Stone Age with ill-advised tax policy into the state constitution. But what's good for the goose is good for the gander. State tax policy does not belong in the Oregon state constitution. And finally, I will touch on the issue of fairness. And I don't believe that it's a fair policy for the legislature to say, we're going to put kids at the front of the line, but we're only going to do it if we pick on a convenient, low-income, addicted minority to shoulder the cost for a program that really should be borne by all of us. And the issue of fairness, I think, should be foremost in people's minds as they contemplate this issue. Thank you.
Thank you both. The first question will go to the proponents, Representative Gelser. Representative Gelser, every new program, no matter how well designed, always has administrative cost and some imponderables. Why did the proponents decide to create the new health plan, the Kids Healthy Initiative, rather than funding existing health programs for children?
Thank you. The problem that we have today is we actually have 60,000 Oregon kids that should be eligible for programs, but we don't have the money to pay for it. The Healthy Kids Plan will provide that financing to bring those kids into the Healthy Kids Plan and expand health coverage to the low-income children of working families across the state of Oregon. This program is not just about the insurance, it's about access. We're going to have rural health clinics, we're going to be investing in a safety net, and we're going to make sure that kids are able to actually get to doctors. It's not just about having a card, it's about having good preventive health care available to them when they need it. We're not creating a new bureaucracy, we're running these through existing programs, the Office of Private Health Partnerships, and the Oregon Health Plan and FEOP. So this is a strong, accountable, efficient program that is going to provide health care to these 100,000 kids that really need it.
Mr. Wilson, you have 30 seconds to respond if you'd like.
Yes, we do in fact have a problem with existing programs that aren't covering 60,000 kids who are eligible today. But look at what the context is. The legislature had $2.5 billion extra this biennium over last. They're spending money on parking garages in Hillsborough, capital renovations for $50 to $60 million. They're even getting MSA payments from tobacco companies that could easily be dedicated for these purposes. But the fact of the matter is, it hasn't been a priority for the legislature to this point when it easily could have been.
The next question is for Mr. Wilson. Mr. Wilson, certainly the amount of money being spent on your side of this issue is unprecedented for an Oregon ballot measure, most of which is coming from large tobacco. Why shouldn't Oregons be deeply concerned about that and the change in our history of grassroots involvement in ballot measures and in referrals?
Well, I'm not going to defend $11 million. It could well be overkill, and I'm not going to sit here and say that $11 million is A-OK. But what I will say is that the issues surrounding this measure stay the same. The constitutional issue doesn't go away. The fact that most of the money doesn't go to Healthy Kids program doesn't go away. The fact that this program isn't sustainable doesn't go away. And I would just wind up by saying there is remarkable self-interest in both sides of any campaign. It's always been that way. The evidence of that is clear on our side. The tobacco companies obviously have a self-interest. There are my friends on the other side of the issue who obviously, with regard to the healthcare providers, the insurers, hospitals, and the like, who anticipate getting a fair chunk of change through this measure. So they obviously have a stake in advancing the yes position. So self-interest is evident on both sides.
Would you like to respond?
I would. Thank you so much. The Legislative Revenue Office just a couple of days ago released their analysis of Measure 50, and on page 3 it demonstrates that 72.34% goes to Healthy Kids in 07-09 and again in 09-11. The money for Healthy Kids goes to Healthy Kids. And to be clear, the real beneficiaries of Measure 50 are over 100,000 Oregon kids who don't have access to health insurance that will finally get the care that they need.
I'm going to ask another question to Mr. Wilson. You raised the issue of fairness, and as I understand it, here and elsewhere, the No campaign has made a number of arguments about fairness, including whether it's fair to tax a subset of the population, particularly perhaps a poor and unsophisticated group, or smokers in particular. And I guess my question is this. There are studies that suggest that for every pack of cigarettes consumed, there are about $11 in health care costs overall. And even with this increase, the Oregon tax would be about $2.03 a pack. So why is this unfair? Why isn't this just a very modest user fee for some of the costs that society bears?
Quite simply because the connection between smoking and the lack of health insurance for children is dubious at best. You can't make that connection. If you were talking about a cigarette tax that was dedicated to smoking cessation, that would be an honest debate. If you wanted to talk about a cigarette tax that went toward the health care costs of people engaged in smoking exclusively, that is an honest debate. But to talk about, in fact, I even heard that the Tribune newspapers are assessing employees who smoke an extra premium on their health insurance. To me, that is an honest way to get at those costs. But to tax smokers for something that they have no bearing on, which is the health insurance status of children, I don't believe is an honest debate. That connection is dubious at best.
And you have 30 seconds to respond to the same question if you'd like, or to his comments.
I would, thank you. There's a direct connection between smoking cigarettes and kids' health. Children are much more severely impacted by exposure to secondhand smoke than adults. It drives many of the expensive treatments and hospitalizations that children experience each year. For example, a child that spends just an hour in a smoky room, for their body, that's the equivalent of smoking 10 cigarettes themselves. It's only fair that something that's poisoning these children would help to pay for their health care to keep them healthy.
Representative Gelser, the next question is for you. The opponents have raised, and the City Club has been sympathetic to this, and I am as a constitutional lawyer as well, the question of whether it's appropriate or seemly to put this kind of measure in the Constitution. I'd like you to address that issue of why we're doing that. And as part of that, could you address why didn't the legislature, even if it couldn't muster the 60% for the tax itself, why didn't they refer a statutory provision rather than a constitutional provision?
Thank you. It's a very interesting thing that besides requiring a 60% to just do the program, it also requires a 60% majority to make a statutory referral to the voters. It only requires a 50% majority to do a constitutional referral. We tried very hard to do a statutory referral. Unfortunately, the tobacco industry lobbyists were very successful in pulling votes off of that statutory referral. In fact, if everyone that had voted for that measure on Monday voted for it on Tuesday instead of protecting each other, we would have a statutory measure right now. The Constitution is the place where we protect what's most important to Oregon, and I believe that kids' health should be among the most important things that we Oregonians value. I also believe that at the end of the day, if our choice is between a constitutional amendment putting an 84.5-cent tax in the Constitution and doing nothing to help over 100,000 kids that need health insurance today, the choice should be to say yes to those kids. They're counting on us.
Mr. Wilson?
Yeah, it's important to remember this constitutional amendment does not protect kids' health or specifically say this money has to go to children's health care. What the constitutional amendment does is simply put a tax in the Constitution. You don't want taxes in the Constitution because there are different revenue needs, program needs that would require changes, which you can't get in a constitutional amendment unless you have another vote of the people, which is precisely why the Democrats are suggesting to repeal the double majority, in which I am also suggesting it's not appropriate to put in a product tax.
Mr. Wilson, the next question is for you. I want to follow up a bit more on the constitutional question. I think I'm very interested to hear you say that you are going to favor eliminating the double majority in the future as well. I'm curious about some of your big funders, your big clients. Have any of them in the past supported, opposed measures because they thought they were inappropriate to go into the Constitution, unrelated to cigarette taxes, or in the future, would any of them be willing to support a measure that would perhaps make it harder to amend the Constitution or at least the Bill of Rights by, say, a two-thirds majority?
I don't think we have any issue with that. In fact, I would go so far as to say there are proposals being floated for sort of a constitutional convention or a spring cleaning to get a lot of this garbage out. And I don't think the solution is to say, well, the Constitution is already mucked up, so let's just add another thing to it. I think the solution is the opposite. Let's talk about what doesn't belong there and get it out. And I think it's quite appropriate to have a discussion about upholding the sanctity of the Constitution and making it harder to amend.
Representative Gelser?
Thank you. I would say the opponents of this measure have a history of doing one thing, and that is protecting tobacco profits by making sure that they can get cigarettes into the hands of anyone who will smoke them, including marketing to children, low-income, and minority people. The folks that are spending money to defeat this measure are not doing it because they're concerned about the integrity of our Constitution. They're doing it because they want to ensure high profits for the tobacco industry.
Representative Gelser, the opponents and some others have described this tax as at least potentially regressive and unfair, placing a high burden on citizens who are sometimes least able to pay economically. What is your response to that, and how do you deal with the fact that we'd be generating a large amount of tax revenue from a relatively small fraction of the population?
Well, I think as you indicated in a previous question, we're all paying the cost of tobacco use, and it's a very high price. It burdens our healthcare system, it drives up costs, and it reduces productivity for employers, and it makes those of us that don't smoke suffer the consequences of secondhand smoke. But I also know that the people that are supporting this measure are faith leaders, the leading health organizations, family and public health advocates, are people that have a history of looking after the interests of low-income and working Oregonians. They're doing this because they know that over 100,000 Oregon kids don't have health insurance, and this is a way to deliver health insurance to those kids. Low-income Oregonians are concerned about keeping their kids healthy. That's one of the most important things that we can do. That's what this measure does, and that's why it's appropriate.
Mr. Wilson?
There's no doubt whatsoever that this is a regressive tax, and the fact of the matter is we wouldn't even conceive of taxing these same folks in any other way, whether it be a sales tax or income tax, because quite simply they are on the lowest income thresholds in our state. And so, our point of view is this is in fact regressive. We would not ask these folks to pay a tax in any other way, but because it's a cigarette tax, somehow it's okay.
Mr. Wilson, the next question is for you, and you may or may not have anything to do with this particular issue, but some folks have complained about some of the ads being put out by Oregonians against the blank check, particularly an assertion that says that putting the money into a rainy day fund and not immediately spent means that it would not be spent on children's health. Some have suggested that that is at best misleading. I'm interested in your response to that and what your position is on that particular ad or the ad campaign in general.
Yeah, well, thank you. The numbers are the numbers. I mean, the tax raises $147 million, 36.9 of which is dedicated to the Healthy Kids program. The fact of the matter is over half the money, $75 million, is unexpended and unallocated. It's not constitutionally dedicated, it's not statutorily dedicated, except for the fact that it has to be spent on a DHS program. I have never in my lifetime seen a pot of money the size of $75 million sit there in the legislature without being spent, and I think it's perfectly appropriate to call that into question. This is not a lockbox. This money is not in a lockbox. It's not isolated just for a specific purpose. The legislature physically has to come in and allocate the money. And like I said, there's only one word for a $75 million pot of money sitting in the legislature, and that is spent.
Representative Gelser?
Thank you. First, I would point out that this legislature enacted our state's first rainy day fund this past legislative session, setting aside over $300 million. So clearly, we know how to save for a rainy day. And if you read the Legislative Revenue and Legislative Fiscal Office analyses, you will see that in the first year, that additional funding is held over into the second year, and it continues to roll forward as a mini rainy day fund to protect this very important program, which is providing health insurance to over 100,000 Oregon kids.
I want to change up just a little bit by asking a question that that is really directed at both of you. So you can each take a full minute in responding to this question, and then maybe we'll have 15 seconds of rebuttal both ways. And that is this. Both sides have focused on the impact of this tax on smokers. To some extent, the opponents have been arguing that tobacco consumption is going to go down. This tax presumably would make it go down further, and therefore the revenue projections are unreliable. The proponents are relying on the chunk of money here, as opponents have said, for a Healthy Kids initiative that will probably get more expensive, certainly not going to get less expensive, and if in fact smoking goes down, we will have declining revenues. So I'm interested in both of your reactions to the economics of this, and you can comment on it any way you want, include perhaps the fact that typically with a tax, some portion is paid by the consumer, some portion usually absorbed by the company, and what impact that has on your responses. Why don't we start with Mr. Wilson?
Yeah, I'll go ahead, and then Sara can take a swing at me. The issue with regard to the sustainability of the tobacco tax, interestingly enough, even with this legislative fiscal report issued earlier this week, they're already downwardly revising projections for the cigarette tax income to accrue to the state. The $152 million projection has been downwardly revised to $147, but even more shockingly is next biennium, the $233 million projection has been downwardly revised to $208. And so you see a stark example that the revenue you hope to materialize through a cigarette tax is not at all reliable and may not, in fact, even be there when you need it most. And so that calls into question, again, the stability of the tobacco tax and its reliability as a funder for this program. I know the proponents like to say it's a stable source of income and predictable, but I would suggest if our general fund was this stable and predictable, we'd be in a dire mess.
And 1 minute for you, Representative Gelser, your own. You don't have to respond. Your own view on this.
Great, thank you. I had the opportunity to serve on the Revenue Committee where we got to hear the ins and outs of how revenue projections are made. And I am convinced by our Legislative Revenue Office that this is a very sustainable tax into the future. It is true that unfortunately the tobacco tax is more stable than our income tax. Other states that have increased their tobacco tax have seen their revenue increase. They have not seen declines. The adjustments in the revenue statement that JL referenced earlier were in response to the implementation of our statewide smoking ban. We do recognize that that will reduce our tobacco revenues. But if you look at the very end of the legislative revenue report, he writes, the revenue estimates contained in this report account for these risks to the extent possible, with the objective of producing an estimate that has an equal probability of being too high or too low. So I have great confidence in our independent, nonpartisan Legislative Revenue Office. Their job is to help the legislature make smart, sustainable positions. They have no self-interest. They do not have profits at stake. I trust LRO. Thank you.
Rather than giving you each rebuttal, I'm going to do a quick follow-up for each of you on this topic. For Mr. Wilson, let's suppose you're right and the tobacco revenues decline for the state decline substantially. Isn't that, in fact, a net good, including a good for the people who are currently smoking, who may be deterred from smoking by this increased tax?
I don't think there's any doubt that reduced smoking is a good thing. The only issue is, are you trying to fund a growing program with it? And that is the illogic of the cigarette tax. Whilst we acknowledge that cigarette tax receipts declining is a good thing because it means less consumption and less sales, it then seems counterintuitive to say we are then going to support a program with growing needs and growing appetite for tax dollars, and we're going to fund that program with a declining revenue source. It just doesn't make sense.
And briefly for Representative Gelser, does it trouble you at all that we are relying on people consuming an unhealthy product to generate revenues, that we're depending upon that, and that in a way, the projections, if they do go down, don't support the Healthy Kids Initiative as much as they otherwise would?
I'm convinced of the stability of the tobacco tax moving into future biennia. And what really troubles me is knowing that we have over 100,000 kids that don't have access to the health care they need. That's what this is really about. And if the trade-off is that we're going to help thousands and thousands and thousands of adult Oregonians quit smoking and help 15,000 Oregon kids never start smoking at all, to me, it seems like the choice should be to support this measure, which helps to reduce smoking and most importantly provides that health care for the kids that need it.
Well, I would like to thank both of our speakers for a very spirited debate so far, and at this point, I'd like to open it up for City Club members to ask questions from the floor.
I am Oliver Massengale, City Club member. I note in reviewing my voter's pamphlet, Mr. Wheeler, that you have put 7 separate arguments in opposition in the voter's pamphlet to Measure 50. I would like to ask you, why would you author and pay for 7 separate arguments? That costs $3,500. And a second question, can you tell us how much of your funding for Oregon's Against the Blank Check comes from North Carolina?
Thank you. It's a good question, and I expect that at all these venues. The issue of whether I author, I just submitted ballot measure statements. Every campaign is free to do so, and we exercised our right to do it. I don't really perceive that that's a big deal. But to answer your question in terms of our funding, it is with R.J. Reynolds exclusively.
Next question.
I'm Bill Connor, City Club member, and I would like to take the position in behalf of a smoker. If I were a smoker, as the New England Journal of Medicine recently reported, actually this week, I would be among the 450,000 Americans that would die each year from lung cancer, heart disease, and many other illnesses. So I have an addicting problem as a smoker. What can we do about the addiction? The tobacco tax is one good thing, because when tobacco is heavily taxed, smoking rates do go down. They have been constant, about 20 to 25% of the population over the past few years, and it's time to do something to stop smoking. But I wonder if we should go even further, and this is the question I would like to ask the panelists. I don't think this tax, which is in behalf of children and which I support, is going to do something to the new smokers. We need to do something really to get at the advertising which co-opts young people into this pernicious addictive habit. Would you advocate in behalf of all the people of the country who are smokers and those who will be smokers because of the advertising that we should classify smoking as an addiction as severe as methamphetamine, morphine, opium, heroin, and so on, and that we should ban advertising? The question is, should we ban advertising?
I think we have the question. Let's start, I think it's to both panelists. Representative Gelser, why don't you go first?
Thank you. One of the things that I failed to mention about Measure 50 is that we will be addressing the issue of addiction. This measure will allow us to double our spending on tobacco addiction, cessation, and prevention programs. So we're both targeting individuals who haven't yet started smoking and those that already are. They will be better able to access the treatment that they need in order to quit smoking. The way that the tobacco industry targets to young people, to low-income people, and minorities is abominable, and we need to hold the tobacco industry accountable for taking advantage of our vulnerable populations and keep them from making profits at the expense of their health. The idea that the tobacco industry would spend $10 million in order to stand up for low-income Oregonians is very odd to me. They are not the banner carrier for consumer protection. They sell a product that kills their customers. They aren't spending this money because they care what happens to the people that buy their products. They're doing it because they want to protect their profits.
Mr. Wilson?
Yeah, thank you. I think there's no question that smoking is addictive, and I think it's a reprehensible state policy that profits from people's addictions, much in the same way as the lottery. And I think it would be an honest debate if we talked about Measure 50 as a sole funder for something like smoking cessation, something that directly has a bearing on smokers, or adult health care for people who smoke to recover the costs for people who have smoking-related illnesses. But again, the nexus between smokers and the problem of the uninsured children of this state, there is no nexus, and that's why this is not an honest debate.
Hi, Charlie Burr, City Club member. My question is for J.L. Wilson. A lot of arguments have been made against this measure by the tobacco industry, R.J. Reynolds, particular to the 60,000 kids who are eligible for health insurance but are not enrolled. And what those ads do not show is that there's simply not enough money right now in the programs to pay for them, which is what Measure 50 provides. So my question is, would R.J. Reynolds and would your coalition support a statutory measure to support these kids?
Thank you. Good question, Charlie. The issue of the 60,000 kids is not one that our campaign is making. That's the other campaign. However, with regard to the 60,000 kids and is there a need for this funding, I absolutely agree. But has there been opportunity? Absolutely as well. The legislature had $2.5 billion extra to spend, and they chose to spend their money elsewhere other than buttressing these programs to ensure these kids. Now, your question falls on us. Would we be willing to support a statutory measure? Probably not, but what I would say is that the state gets today about $40 to $45 million of master settlement agreement money that was from the state's lawsuits with the tobacco companies, and we've many, many times offered that money up as a means to sustain and increase the programs for children's health care. In fact, we offered it to fund this program at its inception, but that was our suggestion, and it was denied.
Chris Wu, City Club member. I've spent the last year working to eliminate tobacco use at a large healthcare institution. And I'm concerned that Measure 50, although I really, really want to like it, smacks of the Oregon Health Plan. My question is for Representative Gelser. What have the supporters of Measure 50 learned from the Oregon Health Plan's successes and failures to help make Measure 50 a success over time?
Thank you for that question. It's important to recognize that Measure 50 is not simply an expansion of the Oregon Health Plan. While it will enroll about 60,000 children who are eligible for the S-CHIP program in that program, it is also going to give kids access to private insurance. Private insurance companies that you know, like Regence Blue Cross Blue Shield and Providence, all the names that maybe you have in your wallets, are going to come and competitively bid for these contracts. And these children are going to have better access to health care because they are going to have private insurance. It's going to make it easier for them to get the preventive care they need, and it's going to make sure that they're able to get to a doctor when they need one, once they have the funding. The other thing that's important is part of the Healthy Kids Plan is the implementation of a statewide nurse advice line, some funding to ensure some continuity so that the federally qualified health care centers and safety net centers can be reimbursed for the care that they provide to children. And we're making some investments in rural areas to make sure that kids in rural areas, once they have this funding, are able to have doctors that are available to provide to them. So we know that this isn't just about the funding, it's about the infrastructure, it's about access, and it's about prevention. The Healthy Kids Plan is a comprehensive plan that looks at how we can have healthier kids all across the state of Oregon, and really all kids are going to benefit from this plan.
Hello, I'm Roberta Palmer, City Club member. I noticed that the federal S-CHIP program was also to be funded with a tobacco tax of 40 cents. So I wonder if Mr. Wilson also feels that the federal Congress and the Congressional Budget Office are in the dark about the reliability of a cigarette tax.
Well, I think, thank you, and quite honestly, I don't presume to know what Congress is thinking about that issue. What I would suggest, though, with the S-CHIP and the cigarette tax, that will obviously have a bearing on Oregon receipts. Our receipts would decline even more because of the federal tax that was imposed, which would make it even more unreliable as a source of revenue for the Oregon program. But what goes unmentioned is the federal regulations that accompany the S-CHIP, which I'm not saying I agree with, but they're saying if you don't cover 95% of your kids through your own state programs, that there's not going to be matching funds for kids between 200% and 300% of federal poverty level, who in this program we're offering significant subsidies for. And that portends some hairy budget situations if that money doesn't come through, because all of a sudden this plan goes from being insolvent to massively insolvent.
Guinevere Milius, City Club member. I'm going to ask you a question beyond ballot measure 50. I know we're here to debate that, but I see a legislator here and a lobbyist sometimes for small businesses, and I see an opportunity to ask this question. I think we can all agree that there could be more perfect ways to fund a children's health initiative, and that a tobacco tax is less than perfect, but here we are. Both as a legislator and as a lobbyist, are you hearing from small businesses anything about removing the burden of providing insurance for employees and by extension their children from employers? Are Oregon's businesses starting to look at something other than business as usual when it comes to health insurance in the face of a growing healthcare crisis across the state and across the nation?
I think that's a question for both of you.
It's for both of you.
Why don't we start with Representative Gelser?
Thank you. I'm glad you asked that question. One of the challenges that we attempted to address during this legislative session was the question of comprehensive health care reform. We all know that health care is becoming very difficult to pay for, very difficult to afford, and more Americans are going without access to health insurance. We also know that in today's system, being insured is that door to access. The legislature passed Senate Bill 329, which is creating the Oregon Health Board. We are going to be looking at how we can construct a system of care in the state of Oregon that ensures that every Oregonian has access to the health care that they need when they need it. And it's very important to continue that conversation, and I think that we have a long way to go with that. However, the issue that we have before us today is Measure 50 and these kids. We can't, with Measure 50, reform our entire health care system, but we can provide the kids that are alive today with the health care they need today. They can't wait until we finish the work of Senate Bill 329. They need Measure 50 today. It's the right time to do it for them.
Yeah, I don't think there's any question hearing from the business community that they're not married to the current system anymore. And any system that delivers them 12 to 15% cost increases on average is unsustainable and can't work. So I don't think there's an allegiance to the current day system. I'm not saying that any other proposal out there is acceptable. We did support Senate Bill 329 through the associations I represent, because I think, and even the work of former Governor Kitzhaber, because it is time to start looking at other alternatives and seeing if there's any other viable alternatives out there than what's currently saddling with these cost increases. So I personally support the movements we're making forward towards looking at other options.
Leslie Moorhead, City Club member. I'll thank our previous questioner for opening this up into a broad arena, and so I'll do the same thing. This is a question for both of you, but I want to follow up on what Mr. Wilson brought up briefly about fiscal measures in the Constitution. The people that you represent and apparently people you talk to may support, as you said, an effort to revise the Constitution or revisit the Constitution by means of a committee, commission, or even a constitutional convention. I think I heard you say that. In your view, would it be a subsequent or a stable question to ask, should we take all fiscal measures out of the Constitution? Should we have a policy that says we don't have any taxes, revenues, or expenditures as constitutional issues? Those should be out of the realm of what belongs in the Constitution, the state Constitution.
Thank you. I don't know the ramifications of that, so it would be premature for me to say anything. I'm sorry, I wish I could give you a definitive answer. I will say that tax policy, you look at what's happened with tax policy in the Constitution, and just as far as what I know, is the double majority particularly working? There's a lot of local communities that would say no. I bet a lot of you who voted to put the kicker in the Constitution probably wish you had your vote back. With regard to the gas tax and how that's allocated, you can make a good argument that that has precluded us from getting funding solutions for the state police because we have constitutional dedication of those funds. And I think that same logic applies to the cigarette tax. So has it encumbered, flexible solutions to problems? Yeah, and so that's why I have a jaundiced eye towards these types of proposals.
You want a brief comment on that, Representative Gelser, and then I want to get us back to Measure 50.
Yes, I would. I think that the issue you raise is a good one because some of the misleading information from the opponents would suggest that this is the only tax issue that we have in our state constitution. Our state constitution is where we've embedded Measure 5 and Measure 50, which has led to some of our school funding crises. We have all sorts of things that are there. Measure 50 simply puts an 84.5-cent tax on tobacco into the Constitution, which is lower than the statutory tax we have right now. The legislature could come back and drop that tax all the way to 84.5 cents. So there's still a lot of flexibility, only we're locking up in the Constitution that 84.5 cents is going to pay for health care.
We have time for one more question.
I'm glad I'm here.
We have one more question.
John Polinick, City Club member. I came in here thinking it was a slam dunk to vote for Measure 50, but now I'm really confused. As an Oregonian, I'm all about sustainability. And if we lock in this measure into the Constitution, let's say next year nobody smokes. Does this mean we taxpayers now have an unfunded liability that is locked into a Constitution? And I want to say thank you for City Club for doing these things because this helps me understand how to vote, and I'm very confused right now. So this is a yes or no question, and I direct it to the legislator. If nobody smokes next year, and there are no tax collections, what happens to this constitutional mandate? Is it an unfunded liability?
I'm going to use the prerogative of modification. It's a great question, but I'm going to strike the yes or no because I think both sides may need some explanation. But Representative Gelser is directed to you first.
Thank you. Unfortunately, that's not going to happen. Measure 50 is not going to cause everyone to quit smoking. We see that in other states that have increased their tobacco taxes, their revenues have continued to raise. And this is the reason why. If I sell you 10 widgets and they each cost 25 cents, and then I raise the price of those widgets to $10, and I only sell 5 more, I'm still going to make more money selling you the fewer number of widgets because it costs more per widget. The second thing is, the piece that goes in the Constitution is not the policy about the health care program. It says that the 84.5-cent tobacco tax, the 84.5-cent cigarette tax must be dedicated to kids' health care. It's then tied to statutory legislation that describes the program and how the program itself is run. We are not locking a policy into the Constitution. We are not locking a program into the Constitution. We are locking a funding source into a Constitution. It says that 84.5 cents of the tobacco tax must be spent on health care.
I think think that may have sort of been directed to both of you, so I'm going to give you 30 seconds.
Yeah, I actually agree with Sarah, and that is, I don't believe it's an unfunded mandate. If the tax doesn't materialize, you simply don't have the kids insured that you projected to be insured. And from our point of view, if you have an unsustainable revenue source, that has its own set of problems. Are we going to insure kids just to kick them off? Are we going to take from other programs to keep this program afloat? Are we going to raise taxes on smokers more? Are we going to raise taxes on non-smokers to keep the program afloat? But those are the issues that come along with what I consider to be an unsustainable revenue source. But to answer the question about an unfunded mandate, honestly, I don't believe it is.
Thank you both, and thank you for the questions. We now have the final statements, and I'm going to reverse order and have Mr. Wilson go first since he went second last. So we'll have 2-minute closing statement from the opponents of Measure 50.
Thank you. I'll reiterate my opening statement. We oppose this for 4 particular reasons, first of which the money is not dedicated to the Healthy Kids program. The tax collections here, only 25% goes to the Healthy Kids program. Over half the money is unexpended. It's not in a lockbox. It's not dedicated to Healthy Kids, either in the Constitution or in statute. That money is open game for any DHS program, and that, to me, for a program that bills itself as Healthy Kids, there's not a lot of healthy kids there. The sustainability of this program needs to be called into question. Not only do you hope to insure 100,000 kids, but there's an extra universe of 150,000 other kids who are between 1 and 200% of federal poverty level who are getting their insurance through private means, who will undoubtedly be partaking in this program. And that hasn't even been accounted for. And yet we're hoping to fund this program with a revenue source that we know is going to decline over time. This would, in fact, be the first product tax in the Oregon Constitution. We've never used our Constitution to tax people before. It is a dangerous precedent, and I don't believe that Oregonians support that dangerous precedent. You can lock yourself into the Stone Age with tax policy if you put tax policy in the state constitution, because quite simply, you can't do anything about it once it's there without another election of the people. And finally, I will again invoke the issue of fairness and priorities. The legislature, with 20% increase in revenue, MSA payments from tobacco companies, have plenty of opportunity to cobble together money to buttress current state programs and get these kids insured, but quite simply the priorities were elsewhere. So they're asking you to tax the other guy for an insurance program that should be important to all of us. And that is a significant fairness issue, and in and of itself, I think warrants a no vote on Measure 50. Thank you.
Representative Gelser, you get the final words.
Thank you. I wanted to rebut something quickly. Of this over $2 billion that the opposition keeps referencing, please remember that you're going to get over $1 billion of that back in your mailbox. And I'm not sure if the tobacco industry is suggesting keeping back the personal kicker to pay for kids' health care, but that is where a good chunk of that money went. This measure is about providing health care to over 100,000 uninsured children in low-income working households. It provides a low-cost alternative to working households who can't afford the cost of insurance. It dedicates the money that it raises to health care, and it places this money in a constitutional, dedicated fund that politicians and lobbyists can't touch for other purposes. I refuse to believe that providing health care to children is a Stone Age children. Instead, it surprises me that in the 21st century, in the richest nation on earth, that we even have this problem of having kids who are sick that are going without access to desperately needed care. If you were to take all the kids in Oregon, over 100,000 of them, who are uninsured and don't have access to care, and put them in a long line, that line would stretch 40 miles long. It would go from the Capitol building of Salem to right downtown here in Portland. For me, if I look at all of those kids, if I was driving up the interstate and looking at them and balancing that against the questions that are always going to hang out there about a new program, we never have guarantees and certainty about the future. What we have is good information based on research and study from nonpartisan, independent sources that tell us that this is sustainable and safe and it's the right thing to do. It is absolutely critical that we provide the health care that these kids need. Success has many mothers. All of you can help parent this success by voting yes on Measure 50 and making sure that every child in Oregon has the care that they need before they're sick, and when they're in emergency. This is what low-income working families really care about, and I hope you'll join me in doing the right thing for these kids. They simply can't wait. Thank you.
Please join me in thanking both of our speakers for elevating this discussion.
Wow, another great debate for City Club. Steve Cantor, thank you very much for your preparation and great job of moderating. Timekeeper Chris Smith, thank you for your timekeeping. And one other group deserves thanks. The City Club research committees who've done the research and spent a lot of hours on both Measure 49 and Measure 50 also deserve our thanks. Thank you again. We're adjourned.